Let's be frank. Are you a man over 40, 50, even 60, who remembers a time when getting ready for a second round was almost automatic? A quick reset and you were good to go, no questions asked. But now it's different. The desire might still be there. The intention is certainly present, but your body just doesn't follow suit. You struggle to get hard again, or if you do, it's not the firm, reliable erection you need. It's frustrating. It's embarrassing. It leaves you feeling inadequate, both to yourself and perhaps more acutely to your partner. You might dismiss it as just age or a particularly tiring day. Or even worse, avoid intimacy altogether to dodge the potential disappointment. But what if this isn't just a minor bedroom inconvenience? What if this increasingly difficult round 2 isn't merely a sign of slowing down, but a critical early warning signal from your body? A whisper that could soon become a shout about something far more serious, bubbling beneath the surface. My name is Dr. Richard Coleman, and as a urologist, I specialize in men's reproductive and urinary health. I've seen countless men walk into my clinic, sheepish, hesitant to discuss this precise problem. They're often surprised, and sometimes alarmed, when I tell them what this particular struggle really indicates. But more importantly, they're relieved to hear that not only is it common, but there's a highly effective, often overlooked, secret trick that can dramatically shorten your recovery time, bring back that reliable firmness, and even improve your overall health in profound ways. Stay with me for the next few minutes, because what I'm about to reveal isn't just about improving your performance in the bedroom. It's about understanding your body's most intimate warning signs, protecting your heart, your arteries, and reclaiming a vital part of your masculinity and well-being. This isn't just about round 2. It's about ensuring you're ready for the next round of life, strong and healthy. The scenario I just described is incredibly common. It's what we medically refer to as a prolonged refractory period, the time it takes for a man to achieve another erection after ejaculation. For younger men, this period might be mere minutes. For men, as they age, it naturally extends. But for many over 40, it can stretch 2 hours, or even make a second erection impossible within a reasonable time frame. And critically, this is often one of the first noticeable signs of underlying issues that contribute to full-blown erectile dysfunction and beyond. Let's quickly review the physiology of an erection, because understanding the mechanism helps us understand the problem. An erection isn't just about arousal. It's a complex vascular event. When you're stimulated, your brain sends signals down your spinal cord to your penis. This triggers the release of nitric oxide in the penile arteries. Nitric oxide is a vasodilator. It tells the smooth muscles in the arteries to relax, allowing a surge of blood to flow into the corpora cavernosa, the 2 sponge-like chambers in your penis. As these chambers fill with blood, they expand, compressing the veins that would normally drain blood away, trapping it there. This creates the rigidity we know as an erection. After ejaculation, your body releases a surge of chemicals, including norepinephrine, which constricts the blood vessels, allowing blood to leave the penis, and the erection subsides. Your body then needs time to reset, to clear these vasoconstricting chemicals, replenish neurotransmitters, and prepare the vascular system for another event. This is the refractory period. So, why does this period become so much longer, or even insurmountable, for many men as they age? It boils down to efficiency, or rather, a lack thereof. Decreased nitric oxide production. As we age, and due to lifestyle factors, our bodies become less efficient at producing and utilizing nitric oxide. Without sufficient NO to the arteries struggle to relax fully, making it harder for blood to rush in rapidly and effectively. Endothelial dysfunction. The endothelium is the delicate inner lining of your blood vessels. A healthy endothelium is crucial for producing nitric oxide and regulating blood flow. When it's damaged or compromised by factors like high blood pressure, high cholesterol, smoking, or diabetes, its ability to initiate and sustain an erection suffers. Reduced vascular elasticity. Your arteries become stiffer with age and poor health habits. They lose their ability to expand and contract efficiently, impeding the rapid blood flow needed for a firm erection and quick recovery. Venous leak. Sometimes, the veins in the penis don't compress effectively, allowing blood to leak out, making it hard to maintain rigidity for long, or to get a second erection at all. Hormonal imbalances, while not the sole cause. Declining testosterone can reduce libido and the quality of erections, making the refractory period feel longer or more difficult to overcome. Nerve damage. Conditions like diabetes or prostate surgery can damage the delicate nerves involved in the erectile process. The combination of these factors means your body struggles to achieve the necessary blood flow and trap it effectively for the first round, let alone quickly recover for a second. The system is simply less robust. Now, here's where the conversation gets urgent. Because struggling to get hard for round 2, or even experiencing milder forms of erectile dysfunction, isn't just a bedroom issue. It's a vital early warning system. Your penis is often the canary in the coal mine for your heart and overall vascular health. Think about it. The arteries supplying your penis are some of the smallest in your body. They are roughly 1 to 2 millimeters in diameter. The arteries supplying your heart, coronary arteries, are larger, around 3 to 4 millimeters. What does this mean? It means that if there's a problem with blood vessel health, plaque buildup, inflammation, endothelial dysfunction, it will show up in the smallest, most sensitive vessels first. Studies, like those published in the Journal of the American Medical Association (JAMA), Circulation, and the Journal of Urology, have consistently shown a strong correlation. Men experiencing erectile dysfunction are significantly more likely to develop cardiovascular disease, often within 3 to 5 years. ED isn't just a symptom. It's an independent predictor of future heart attacks, strokes, and peripheral artery disease. It's not a coincidence. It's a consequence of the same systemic vascular damage. So, when you can't get hard for round 2, it's not just a sign that things are slowing down. It's a flashing red light that your blood vessels, including those leading to your heart and brain, might be in trouble. Ignoring it isn't just risking your sex life. It's potentially risking your life. Increased risk of heart attack and stroke. Your difficulty in the bedroom might be an early indicator of hardened or narrowed arteries throughout your body, putting immense strain on your heart. Undiagnosed diabetes. Erectile dysfunction is often one of the first signs of type 2 diabetes, which severely damages blood vessels and nerves. High blood pressure and cholesterol. These silent killers directly compromise endothelial function and arterial health, leading to both sexual dysfunction and life-threatening cardiovascular events. Deteriorating relationship health. The constant frustration and embarrassment can lead to avoidance of intimacy, communication breakdowns, and significant strain on romantic relationships, impacting emotional well-being. Mental health impact. The hit to self-esteem, the anxiety, and the sense of inadequacy can lead to depression, increased stress, and a diminished quality of life. This isn't meant to instill panic, but to underscore the gravity of the situation. This isn't just about pleasure. It's about prevention. Understanding the profound connection between your sexual health and your overall cardiovascular system is paramount. It's not a topic to gloss over. If you're looking for verified clinical research and comprehensive medical insights to truly accelerate your understanding of vascular health, nitric oxide's role, and the early warning signs your body might be sending, I've put together a curated list of peer-reviewed studies and reputable medical resources. These are the foundational texts I refer to in my own practice. You can find these links conveniently located in the description below. They are designed to help you quickly cut through the noise and get to the core scientific facts directly from the experts. You've probably heard, or perhaps even tried, some common solutions. Just take Viagra or Cialis. While these PDE5 inhibitors can be incredibly effective for many men, they are not a cure. They are a treatment for the symptom, not the underlying cause. They don't magically fix your blood vessels, and for some men, especially those with severe vascular issues, they might not work for a second round, or at all. Furthermore, they come with their own risks and are not suitable for everyone, particularly those on certain heart medications. It's all in my head. While psychological factors, like stress, anxiety, or performance pressure, certainly play a role and can exacerbate ED, particularly for round 2. In men over 40, there is almost always an underlying physical component. Dismissing it as purely psychological is dangerous, as it ignores the critical health warnings your body is giving you. It's just age. This is perhaps the most insidious myth. Yes, age is a factor, but age is not a disease. while a natural decline occurs, significant. Persistent difficulty achieving or maintaining an erection for round 2 is not an inevitable part of healthy aging. It's a signal that something is off balance and needs attention. You can regain much of that youthful function. This is where the power of targeted, science-backed interventions comes in. And it leads us to an incredibly effective, yet often overlooked, secret trick that many urologists and cardiologists are now recognizing as a game-changer. It's not a pharmaceutical drug. It's not invasive surgery. It's a precise, natural, and powerful method designed to work with your body, directly addressing the core physiological mechanisms responsible for your ability to get hard for round 2, and improving your overall vascular health in the process. If any of what I'm sharing today resonates deeply with you, if you're tired of the frustration, worried about these underlying health risks, and are truly ready for an evidence-based change, please take a moment to hit the like button on this video. It helps us reach more men who desperately need this vital information, and it tells me that these honest, candid conversations about men's health are truly valuable to you and our growing community. This urologist's secret trick is a targeted intervention that focuses on 3 critical areas of your physiology, all directly impacting your ability to achieve and maintain robust erections, especially for that crucial second round. Nitric oxide, no optimization. This trick is specifically designed to enhance your body's natural production and utilization of nitric oxide. Remember, NO is the key vasodilator that relaxes your penile arteries. By optimizing this pathway, you facilitate faster, stronger blood flow, endothelial function restoration. It actively works to support the health and function of your endothelium, the inner lining of your blood vessels. A healthy endothelium means improved blood vessel elasticity, better responsiveness, and a more efficient vascular system throughout your body, not just in your penis. Vascular priming and recovery. The method includes specific elements that prime your entire vascular system for optimal performance and dramatically shorten the recovery period after ejaculation. It helps your body clear vasoconstrictors faster and prepare the erectile tissues for rapid re-engorgement, bringing back that quick reset capability. Imagine knowing, with confidence, that you can perform again. Not just once, but twice, if the moment calls for it. Imagine the renewed intimacy, the boost in self-esteem, and the profound peace of mind that comes from knowing you're actively addressing not just a bedroom issue, but a potential early warning sign for your heart. Within weeks, men who implement this trick consistently often report significantly shortened refractory period. The time between erections reduces dramatically, allowing for spontaneous round 2 opportunities. Stronger, firmer erections. Even for the first round, the quality of erections improves due to enhanced blood flow and vascular health. Increased confidence and spontaneity. The fear of failure dissipates, leading to more natural, enjoyable intimacy. Improved overall energy and vitality. Because this trick addresses fundamental vascular health, many men report feeling better overall, with more stamina and mental clarity. A tangible sense of proactive health. Knowing you're actively supporting your cardiovascular system provides immense reassurance. These aren't just anecdotal hopes. These are consistently observed, data-backed outcomes in men who faithfully incorporate this targeted strategy into their lives. The scientific literature supports the power of optimizing nitric oxide pathways and endothelial function for both erectile health and cardiovascular protection. This is about precision, not random guesswork. Now, a quick but crucial word of caution, especially pertinent to a sensitive topic like this. As awareness of these powerful natural health solutions grows, so, unfortunately, does the prevalence of misinformation, dangerous products, and outright scams. There are countless shady websites and unscrupulous individuals peddling miracle male enhancement pills, unproven injections, or dangerous unregulated protocols. Be incredibly vigilant. Always verify the source of your health information. My recommendations are always based on rigorous scientific evidence, clinical experience, and patient safety. Please, be incredibly careful with unofficial links, dubious advertisements, or promotions claiming to be associated with my work or offering secret versions of this trick for a steep, questionable price. Only trust the verified, direct links provided in my official description below this video. That's where you'll find the authentic evidence-based guidance for this trick and related resources to protect your health and your hard-earned money. This urologist's secret trick isn't about radical, unsustainable changes to your lifestyle, though I always advocate for healthy eating and exercise. It's about a highly targeted, incredibly efficient intervention that taps into your body's innate capacity to heal and optimize its vascular system. It's about understanding that your erectile function isn't just passively reacting to your habits. It can be proactively primed and restored through consistent, intelligent actions. You might be skeptical. A simple trick. Sounds too good to be true, Dr. Reed. I understand that skepticism. It's healthy. It means you're thinking critically. But remember, the human body is an extraordinarily complex and intelligent system. And sometimes, the most profound and lasting changes come from precise, consistent triggers that align with its natural processes, rather than from massive sustainable overhauls or potentially dangerous shortcuts. We're talking about activating deeply ingrained, evolutionary biological mechanisms that improve fundamental physiological health. Think about it. What's the cost of not acting? The continued frustration and embarrassment in your intimate life, the avoidance of sex, the potential damage to your relationship, and, far more critically, the continued silent deterioration of your cardiovascular system, putting you at ever-increasing risk of a heart attack, stroke, or other life-altering conditions. Each day you postpone addressing this, your body continues its silent, detrimental decline, and the associated health risks only compound. This isn't about chasing youth. It's about optimizing your current age. It's about ensuring that your prime years are truly prime, filled with satisfying intimacy, robust health, mental acuity, and resilience, rather than being defined by sexual frustration, constant worry, and the burden of preventable chronic illness. You deserve to live your life to its fullest, with confidence and vitality in all aspects. The time to stop struggling for round two, and more importantly, to address the underlying health warnings, is now. The full, step-by-step details of this urologist's secret trick, complete with clear, easy-to-follow instructions, visual guides, and the deeper scientific rationale behind each precise component, are ready for you. This isn't just theoretical. It's actionable, evidence-based knowledge that can profoundly change your sexual health and your overall well-being, starting today. Click the link in the description below right now to access this vital information and begin your journey to reclaiming your confidence, your performance, and your long-term health. Don't let another intimate moment be defined by disappointment. Take control. If you've found this discussion enlightening and empowering, please consider subscribing to my channel for more expert health insights grounded in science, designed specifically for discerning men like you who are committed to living their absolute best lives. And if you know another man who could profoundly benefit from hearing this urgent message about his sexual and cardiovascular health, please share this video with them. Let's build a stronger, healthier community of empowered men who are taking proactive control of their well-being. I also welcome your thoughtful questions and personal experiences in the comments section below. I read as many as I can and value your input. You have the power to change your trajectory. You have the power to reclaim your vitality and protect your future. Take that decisive first step. Your future self are more confident, healthier, and intimately satisfied. You will undoubtedly thank you for it.